We'll move on to our second presentation. And for that, we have Doctors Erica Koopman, Dr. and Carolyn Sanders, and we also have Lance Potskin and Lisa Provencher. So I will give you the floor. Thank you.
Thanks, Leana. So good morning, everyone. My name's Erica, and here with my colleagues Caroline and Lisa. Unfortunately, Lance wasn't able to make it today due to some unexpected health things that have come up, but we are happy to be able to integrate some of Lance's feedback into the presentation as one of our co-leads of this work and as a parent partner in the work. So we're here to share a little bit about the story of the Seed BC network and really our work to mobilize knowledge and create more connected early childhood systems across the region of northern BC. So before we begin, we honor and acknowledge with gratitude that our place of work, learning, and partnership takes place on lands steeped in rich Indigenous history and home to many First Nations, Métis, and Inuit people today across the northern region of BC. And today, we're really grateful to be presenting from the traditional, ancestral, and never ceded territories of the Lheidli T'enneh, where we work together as a team. So the outline, we're going to provide a little bit of background to help set the context for our work. We'll then introduce the SEED network, who we are, what we do, before speaking to why it matters, really reflecting our partners' feedback on why it matters, and then how it has supported patient partnership and engagement. And one of the things I'll just flag before we begin, for us, we don't really use the term patient partners when we're talking about child health. Really, our partners are parents, caregivers, and families. So it's largely family partners that we're using because we're connected to health, but sometimes outside of the system of referring to these individuals as patients. They really are our parent and family partners in this work. So we'll begin with a little bit of background. Early childhood really is a critical period in the human lifespan, and experiences during these earliest years. When we talk about the early years, we're talking about birth to age 8, really set the foundation for lifelong health and well-being. And what happens early, socially, emotionally, physically, really all shape outcomes across the entire life course. And we recognize that children grow within systems. So really recognizing families, neighborhoods, communities, and the broader social and cultural environment. And this is reflected in many theories of early childhood development. We see here on the screen Bronfenbrenner's ecological model or ecological systems theory, as well as First Nations perspective on health and wellness. And really, these just remind us to look at health as holistic and relational, and that when we're looking at childhood, we really need to consider all these layers and how they influence the health of young children. And we know that across these layers, timely access to supports, so healthcare, early learning, family supports, can really help buffer risks and strengthen the developmental trajectories for children. But really, families need the right support at the right time. And in reality, this is a very complex and fragmented system. And so the early year system is very fragmented. We have multiple ministries involved, different funding streams, eligibility criteria for services and programs, and it creates silos that make navigation really difficult for families, but also for providers to coordinate across sectors. And this fragmentation really underscores the need for targeted efforts to ensure that children and families receive that timely, connected, and culturally safe support, but also for providers to be working together to better support families in addressing this very messy and complex system. And in northern BC, we add in another layer of complexity to that. So we're working across a huge geographic region with, a relatively small population when we're thinking about other areas of the province, and it's incredibly diverse. We have, 54 First Nations communities, additional municipalities, and communities that are ranging from small rural towns, smaller cities, and then extremely remote areas. And so one of the questions that came up for us is then how do we collaborate meaningfully across this vast and diverse space when we're thinking about supporting families in early childhood? So with that background context kind of setting the stage, we'll move into introducing the SEED network and how we kind of came to be. So SEED stands for Sharing to Change Early Childhood Experiences and Promote Healthy Development. And it really began organically just in conversations between early childhood educators, health professionals, some researchers, some government partners, community orgs, just people who all care about kids and kind of came together to say, how can we address this fragmentation? How can we better work together to collaborate in the early years across the northern region? And really had four initial goals of fostering collaboration for positive change in early childhood, building partnerships with a focus on learning and action and some shared priorities, looking at what are the research needs that are specific to northern BC, and then how can we support knowledge sharing across these different sectors that are all involved in the early childhood space. And so back in, I think 2019 was when we originally got the funding. We received a Convene and Collaborate grant from, at the time, Michael Smith, now Health Research BC, and planned for an in-person summit, which we had to then pivot and deliver virtually due to COVID. So in 2021, we had a virtual summit that was a week-long event, really blending storytelling, panel discussions, Indigenous and Western pedagogies, and with a focus on compassionate systems leadership, bringing together 120 participants across the North working in different areas of child and family services with the focus on the early years. And so we were able to do that initial work, and there's a QR code there for a paper that we published on actually having that summit, bringing people together for this knowledge sharing opportunities. And through this, people, once again, they really talked about early years services being patchy and inconsistent, and caregivers carrying the burden of navigating systems, and emphasizing the need for integration and the chance to do this work together, and how crucial relational work is in bridging gaps in this work. And so from there, the work kind of continued to evolve based on what we learned there. So we built a knowledge hub, so having a website and a newsletter to share information. We established a regional advisory table, and then we began to look at how can we share research and patient engagement opportunities to strengthen northern and rural representation in this work. I'll speak a little bit more to each of those. So this image represents our action plan for the SEED network, and this was created with our regional table that was built out of that summit, and that has been meeting for the past 5 years now. It's been a long time. But really the focus has been those 3 boxes right under the mission. So relationship building, knowledge mobilization, and research and innovation. And for us, it's not that we are, as co-leads of this work, leading all the research, but really ensuring that parents, caregivers, families in the region have an opportunity to be partners in research and to be involved in research. And so sometimes it's sharing the research of other, or research opportunities from others that we are connected with in the province in our roles. But a large focus just on the relationship building and knowledge mobilization pieces. So as I said already, this just kind of gives a snapshot of what some of this looks like. We really focus on that knowledge mobilization through our newsletters and website, and then relationship building through the regional table. And so these are ways that we continue to stay better connected across sectors. It's not one sector owning or leading this work. It's really a group coming together to do it. And so one of the, I would say, most important pieces of this work has been the regional advisory table. And so this really is a structured space. I don't know if I should actually use the term structured because it's, we have a informal agenda, but it's mostly a round table. So space for dialogue, for learning, for collaborative action. We have quarterly meetings where partners share information, identify things that they're seeing that are emerging in their communities. We talk about opportunities to strengthen coordination, a space to really celebrate local innovation, what's working well, what are the strengths, and elevate northern voices. And it's a mix of parent family partners, individuals working in education, in healthcare, in not-for-profit. And every month we have a very consistent, or every quarter we have a consistent group, but we also have people that step in and out of the space as needed too. We recognize that there's some fluidity to this work in terms of high turnover in the northern region, and also, people needing to take care of themselves and step away for a period of time too, and that's okay. And so we just wanted to share a few reflections from the SEED network. And this is, as we were thinking about the presentation, it's different than an individual project because this is the ongoing pieces of, we've been doing this for 5 years. It's not one specific research project that we're working on. But it's really created this space in this community. And, we had to think, why do people continue to show up? Why does this matter to them? What is the important piece that keeps people engaged? And keeps us connected to a community that we have found as a space to find parent and family partners for other projects and for other pieces of work. And so I won't read all of the quotes verbatim, but just wanted to bring in that partner voice as well, because our parent partner, who's one of the co-leads of our team, Lance, couldn't be here today. He was going to speak to some of this himself, but we were able to bring together some other pieces of feedback. So really, when we asked people about why be part of a network, why connect into a space like this, they really described the network as a place that helps rebuild connection. So it's not actually new for the early years to have a shared table or a shared space like this. So some of you, if you are connected in with this, you might know that there were local action tables or community early years tables funded through United Way with Success by Six many years ago already now. And so something that many communities lost over time when that funding got cut. And so people really value the ability to come together across roles and across communities to share knowledge, build those relationships, and reflect on this shared responsibility for children and families. And that it's a place to build those relationships that was brought back. There's a recognition. It's always better when it's in person. We always love connecting in person. It's not always possible, and it's definitely not possible when we're talking about a regional space. But that's also something we continue to look towards. It's how can we bring this group across the region together in person more often. And when people have talked about what has been most valuable, relationships have really been the central part of this work. Through this shared learning, people at the table are saying that they're gaining a deeper understanding of how the different systems intersect and work together, how collaboration can close the gaps, and really just creating a safer space for people to discuss many of the issues that are prevalent in society and they might not have the opportunity to connect with others about within their own community. A space, so we have, a parent partner talking about how it's helped them not only advocate for themselves and their family in areas where they normally wouldn't, by having the space to be able to have those conversations and better understanding, how these different systems work when we're talking about how they work together. And then just kind of a last piece on these reflections is the value of connection. Really how it's opened up pathways for engagement with people across the region who are sometimes isolated and providing with options to connect. And that, these are smaller and often under-resourced communities where resources can be really stretched. And so it's nice to have the chance to talk about that with people who are facing the same realities. So just that knowing that northern and rural context is, we're often working in isolation, but we don't have to be. So it's this place where these connections are really important and help bridge that distance and improve the communication. All right, just a couple last reflections. So how does this support patient-oriented research and engagement? So like I said, we don't usually use the word patient, but we added it for the sake of today's presentation. But really, the key lessons from us is that a learning community like this, the focus itself might not be explicitly patient engagement, but including diverse voices really shapes an understanding of system needs and the areas of opportunity. And that shared learning builds shared responsibility, that this is something that we can then work towards improvement together. It's also been a place that, like I said, reduces that isolation for rural service providers and for parent partners in this work, feeling heard and seen and being able to talk about this with others. I spoke to yes, virtual spaces are efficient, but really that in-person interaction strengthens trust. And so how do we continue to build in more of that moving forward? And that for us, and Caroline maybe wants to speak to this a little bit more, I don't know, or Lisa, but really that compassionate leadership principles have really helped participants to feel safe and valued. That wasn't the focus of our presentation today, but that is something that we feel has been really successful in creating this space for open dialogue with our partners. And that a network like this really does strengthen partnerships that enable future research and resource development. And so these are just a couple examples of things that our network has then been able to help support engaging parents, caregivers, families in the work. So with helping create research proposals, helping create research recruitment materials that have parent and family voice reflected in the recruitment, in helping create resources. So some of our partners in the health system, and I will say I work in the health system, so I have a bias here, but really how can we ensure that what we're creating is something that's accessible for families is by having families engaged from the start. And so having families engaged in the creation of parent-facing materials and the engagement of education that's going to be provided for service providers. So not research specific, but really informing the work that is happening in the health system. And so by having a network like this, we've had that connection with parents and families and with the partners that have those relationships with parents and families to be able to bring them in and engage them more meaningfully in this work from the outset. So this is just our contact info. We're always happy to have people get connected. If you're in the northern region and want to connect and join one of the regional table meetings, it's open membership, so you're welcome to join and get connected. Just reach out to us. And Caroline, Lisa, I'll see if you have, I think we've got a couple minutes to see if you want to add any reflections before we take questions.
I'm okay, Erica. You did a great job. Thanks.
Thanks, Lisa.
Thanks, Erica. I agree. And if anybody wants to know more about compassionate systems leadership and how that kind of shows up for us, we're happy to speak to that. And that's where some of us got together probably around 2018, I would say, when we did some work with the Human Early Learning Partnership, and they came up, and Prince George was one of the areas that was selected, 3 across the province after we'd put an application in, to be able to begin that work with Pippa and Joanne at the time from the Human Early Learning Partnership. So they've been really instrumental in how we sort of set out some of this work, and were a really good guide as we began to build a team and a network and understand that in the beginning. And the compassionate work has continued in other ways across the province. Just for note of interest, is it's heavily embedded in the school district areas these days as well, in some places, as that work continued with the work from Joanne from when she was in the Human Early Learning Partnership. She's now transcended to something a little different, but that's okay. And Pippa now works with the Children and Youth Representative team, or she was last time I was aware. I'm not sure if she's still there, but yeah. So thanks, Erica. That was awesome. And we'd love any questions, because we did come to this in a very different kind of way rather than a research project per se.
Yeah, so there's a question I
We do have.
see. Oh,
Thanks, Erica. It's just struggling with my camera.
That's all good. I know it's hard when you're using someone else's computer. Yeah, so there's a curiosity about how families with children who have complex care needs, physical and/or neurodevelopmental, were included in the work, particularly as the complex mess of accessing navigating services is even more complex for these families and children. And yes, absolutely. It's like, how can you make that complex, messy graphic even more complex and messy? And that's how you do it. And so I will say at our partner table, and this is one of those things I think, Rihanna, that you were speaking to, is people are also coming with their lived experience as long as their professional roles. So we have a lot of individuals who are very fortunate to have at the table that are bringing both of those experiences and that have been working as, kind of started as parent partners or in an engagement role with other organizations and now have moved into like a peer support role. So we have many members connected with like the Family Support Institute and some other organizations that they're coming with that lived experience of living with their own children with complex care needs, and then have now moved into a professional space working and supporting families and bringing that voice. And I would say that's a conversation at probably every meeting, is the complexity of the system for those families, the lack of access, and what it looks like in a rural community where it's hard enough just getting, I'm going to call them traditional services, but and then how do you get those more complex needs met when you have no providers for that, and the travel that's required or the wait list that individuals are experiencing. So we don't have the children themselves engaged as partners with the focus in the early years. It's not that it's impossible. You have to find creative, more arts-based methods to engage those kiddos usually, but it's definitely through the experiences of the families. Caroline, do you want to add anything on that question?
I think, and I'm assuming that's Knock, looking at how Knock's name is showing up there, but I could be wrong. So forgive me if I am. I think it's such an important question, and I think Erica leans into it in the fact that, it's not the fact that we're leading research in that area specifically. It's very much about the ways in which we are trying to bring those places and spaces together. So we do hear about for example, that's why the compassionate systems approach hopefully works in a way that we arrive and we situate what we do. The workload strain and the moral distress and the barriers to success are all very real. And I think, Leana spoke to that about how we're coming up against barriers all the time in relation to that level of inclusion and the way that ableism is situated within our social narrative. So I think we don't have a magic wand, but what we do have is an opportunity for really shared learning. And what's always fascinating at the seed meetings and the networks and the connections is the way in which there is such a kindness and genuine way that everybody wants to find the connections. Oh, this has worked here. This has been really useful here. So in some ways, some of the outcomes have been very much more applied, very relational and very shared, so that there's been an opportunity for other people to either, let's think of some examples, engage in some specific learning that may have helped particular teams, such as in the early years, be able to access emerging ways in which they could learn skills that are then applied in early learning spaces to be able to support children and their families. Simple things such as, if we think about, and Erica, remember the name, if we think about the PT and the OT and the outreach service, access to the services, some of our partners were not aware of the fact that, there are traveling services that can reach into communities. So it's sometimes about liberating that knowledge in ways that then families and children are able to access the things that, albeit all too often people have to advocate for themselves. And I think Erica's PhD work identified that very clearly as the fact that you need to, that strong advocacy voice for families is something that's often driven by families. Rightly or wrongly, that's often where it can fall. And when those connections become fragmented, or they fail to work anymore for whatever reason, then that's where, those cracks, as Suzanne has noted, they don't become cracks, they just become, valleys, if not deserts, for people to be able to connect or reconnect back in. And so I think there's a lot of challenges that are tied up in some of those spaces. But I do think that the network offers an opportunity to be able to help people to keep learning, to keep the motivation going, to keep finding something new, because somebody somewhere is always trying something different. And this space allows people to really share that knowledge in a really comfortable way, that there's no judgment, and I think that's really valuable. So we've heard so many stories like that, and then people have been in touch afterwards. They've made new friendships, new networks, new connections. They've learned different things. They've gone away and tried things. Funding is a great example. The number of people say, there's a fund over here, and then the ripple effect is huge in the fact that then people are able to go and apply for the funding to be able to support what was needed in their local community.
Well, and I
Mhm.
think the only thing I would add to that, and this is a specific example, but it's also to ensure that parent and family feedback is heard in some of these pieces, because one specific example is family connection centers are like a new pilot in the province through the Ministry for Children and Youth with Support Needs, and there's one happening in the Smithers area, and there's a lot we were hearing it come up, a lot of families feeling that they weren't able to access what they needed, that with this shift they yeah, whether it be a misunderstanding, misinformation about what's being provided, they weren't feeling heard in some of the outlying communities that were supposed to have access to this. And really, it was through the network we were able to bring them in as a guest speaker, and they were able to present on what they do provide and how they are collecting feedback, and ensure that those families have the chance to have their feedback incorporated in it. And they learned, oh, we don't know that you actually do come to our community once or twice a week and do this outreach, and that I can access this. And having those partners be able to say, well, this is what families in our community are saying about their experience with it, and that's not being reflected in what is being presented in these other evaluation results. How do we ensure that that voice gets reflected through it? And it really is through those relationships, and sometimes having someone that can be a little bit of that bridge to ensure that it's a space where that dialogue can happen in a safe way. Because if you don't have that connection, if you don't have that initial relationship, it can be really hard to go in and how do you know that you're going to be taken seriously, and that this information, that these people are actually open and willing to listen to it. But if have this, we call it a neutral space. It's not led, I mean, it's led by our co-lead group, but we're also all working for different organizations. There's not one distinct owner. It does, I think we've heard so far that it helps create that neutrality, that there's that comfort to be able to come and share that and say the things that maybe they would feel less comfortable in some other spaces.
Thank you, Erica and Caroline. I see there was a comment, but Erica, rather than a question, but see you already saw it and read it. So
Yeah, and I think the other thing, like the complex care coordination, is true. Like, and Caroline kind of alluded to it. Like my PhD research was on care coordination, but specifically for families with health-related social needs, so like social and economic barriers to care, who also would not be covered by traditional care coordination programs. And I think really, when we're looking at a system as messy as this, everyone needs care coordination, and that's a focus on the provider end of how do we support providers better be able to do that work, because all families across the system would better benefit from that.
are there any other questions for Erica or Caroline? I see that Lisa had to step away, but she did. Rihanna, there was a comment in the chat. Lisa wanted you to know she really enjoyed your presentation. Okay, well, I think that I will again thank all of our presenters. Those were amazing presentations. Apologize again for the delay. Erica, I had misread your comment. You're correct. I believe us switching moderators at the last moment threw a loop, everything into a loop. So, um, and there was one more comment if you guys want to take a look at that.
Yeah,
And yeah,
absolutely, about the care coordination. Like, it is very much localized for urban communities, or it's somebody in Vancouver who's providing care coordination to support to somebody in a rural northern community with no context of what is actually available, or what it would take, even what it would take to get to Prince George. And okay, we're driving 2 hours on a wintry highway or 6 hours on a winter highway, and the cost and stress that comes along with that. So that's the value of we have found of having a northern space for these conversations, is that shared understanding, versus, like, yes, there are networks like this for the early years across the province, which are also great spaces to learn, and we have members that participate at both, but having this space specific to our region and our own realities has been really important for those conversations and partnerships as well.
Okay. Well, thank you, everybody. Thank you, everyone who's able to stay on the line a bit longer. We do have a break now until 11:30, and then we have another fantastic session of presentations. And thank Erica, Caroline, and Leana. It's always a pleasure.